I have been diagnosed with Nutcracker Syndrome and pelvic congestion. Can the pain from swollen ovarian veins and compression of the renal vein mimic pudendal neuralgia? If so, I had the procedure to embolize the veins and fix the Nutcracker syndrome. Could this help my pelvic floor stop tightening and spasming? So Nutcracker syndrome is when the left renal vein is compressed between abdominal aorta and superior mesenteric artery. The left ovarian vein connects through to the renal vein, so naturally there will be an enlargement and varicosities in the ovarian vein. There also may be varicosities elsewhere in the pelvis. And yes, certainly there are areas where engorged veins are going to compress the nerves, and they can absolutely mimic pudendal neuralgia, or actually give you the pudendal neuralgia symptoms. One of the most common areas where this happens is here on the perineum, where there is a dorsal clitoral nerve, and when there is perineal nerve, and those nerves run together with veins. And when those veins get enlarged, there will be a sensation, there'll be a pressure on the branches of the pudendal nerve, giving you some of the symptoms of pudendal neuralgia. And yes, I believe that sclerosing the veins, or actually repairing the Nutcracker syndrome, will help some of the symptoms. But I also feel that what is important is, if you do have those varicosities, is to perform the sclerotization of the dorsal clitoral vein and perineal vein directly. So what I do in my practice, I ultrasound the vulvar area, and I try to identify if there are enlarged clitoral and perineal veins. And if they are, then I inject a sclerosing agent into those veins to occlude them. It is the same sclerosing agents as vascular surgeons will inject in the varicosities in the legs to help the varicosities in the legs. In the second part of the question, you say that you have spasming of and tightening of the pelvic floor. Well, that's another reason to have pain. So of course your pelvic floor also has to be addressed. It is possible that the pain and irritation from your perineal, from your pudendal, from your dorsoclitoral nerves by those engorged veins is causing the spasming. But once the veins are addressed, you actually need to treat your pelvic floor. And for this, I strongly recommend pelvic floor physical therapy, vaginal muscle relaxants or rectal muscle relaxants, and in the cases where the muscles are not relaxing with physical therapy and muscle relaxants, I would recommend injecting botulinum toxin.